morning, all students. So, yesterday I explained regarding a very important term, that is antagonism. Today I will explain the same topic, that is antagonism. Yesterday I told that antagonism means when the two drugs, they act on the same physiological system and they show opposite effects. Two drugs when act on the same physiological system and they show the opposite effects. Which is the physiological system? Physiological system is human body, and yesterday I told regarding this is the human body. And two drugs, this is drug 1 and this is another drug. So these two drugs, they act on the same body, same physiological system, but they show the opposite effects, and this is called as the antagonism. And I told antagonism is of 4 different types. What are the types? The first one is chemical antagonism. The second one is competitive antagonism. The third one is non-competitive antagonism, and the fourth one is physiological antagonism. So here are 4 different types of antagonism. Anta means the drugs when they are acting against each other and show opposite effects. What is the need of antagonism? We are using this term again and again. Antagonism is used basically in the treatment of so many things suppose a person accidentally has taken some wrong medication. So to avoid the unwanted effects of that wrong medication, some antidote or some medicines are to be given to relieve from that unwanted effects. That's why this term again and again I am using. So first of all, I would like to explain chemical antagonism. So suppose chemical antagonism means, suppose a person is suffering from he is suffering from arsenic poisoning. Because of the arsenic poisoning, to avoid that arsenic poisoning, so here B, so this is BAL, that is British antilucide. This is used in the treatment of arsenic poisoning. So this arsenic poisoning treatment is done with the British antilucide, BAL. So this is mostly question is being asked, what is the treatment of the arsenic poisoning? The treatment for the arsenic poisoning is BAL, British antilucide. So what is competitive? The next one is competitive antagonism. Competitive antagonism, yesterday I told that drug, first of all, it has to combine with the receptor, and when the drug combines with the receptor, then only it shows its pharmacological action. So this is very, very important. You must understand this thing. Drug has to combine to its receptor to show the pharmacological action. जब तक ड्रग किसी भी पर्टिकुलर रिसेप्टर के साथ जाके बाइंड नहीं करेगी, it is not showing any effect to the human body. So the receptor can be a protein, receptor can be a channel, receptor can be an enzyme. receptor to show the pharmacological action. So here in antagonism, in competitive antagonism, competitive word has come from competition. I am giving two drugs here. Because antagonism means the competition between the two drugs. तो जो compete कर पाएगी, जिसकी concentration drug की ज़्यादा रहेगी, वो इस particular receptor के ऊपर जाके bind करते हैं. Once again, try to understand. Here, this is a general term. The drug has to combine with particular receptor and show its pharmacological action. So here in the chemical antagonism, in this competitive antagonism, I am giving two medicines. और जिस मेडिसिन की कंसंट्रेशन ज़्यादा रहेगी वो इस रिसेप्टर के ऊपर बाइंड कर लेगी. ऑलरेडी वन ड्रग एंड दिस इज द अनदर ड्रग. तो जिसकी कंसंट्रेशन, जिस भी ड्रग की कंसंट्रेशन दोनों में से ज़्यादा रहेगी, दैट विल शो इट्स इफेक्ट्स. So this is the receptor, this is the R is the receptor, and this is the drug, this again is the drug. So these, either this drug is having more affinity, more concentration, or this drug. This is drug 1, this is drug 2. In दोनों में से the drug which is having more concentration, that will bind to this receptor and shows its pharmacological action. This is competitive antagonism, and this is used in the treatment of for example, when a person suffering from some poisoning, he has you just take the example farmers in the field, and accidentally they inhale insecticides. Why the farmers they are spraying insecticides in the field? Just to get rid of some insects, to prevent their crops from insecticides, pesticides. So they spray all these insecticides into the field. So accidentally they inhale these same insecticides, for example malathion, parathion, or some poisonous substances. They inhale themselves and they suffer from poisoning. It shows very poisonous effects, and it affects the drugs, affects on their receptors, specifically muscarinic receptors, and at that time there is a lot of amount of acetylcholine is there in their bloodstream, because when insecticides goes inside the human body, it stimulates the muscarinic receptors to release more amount of the acetylcholine. But suppose this is muscarinic receptors and they are releasing more amount of the acetylcholine, so the drug in the treatment of that poisoning is given atropine. So atropine, more concentration, by competitively it will block all the actions of the acetylcholine. So this is the competitive antagonism. In detail we will study when we will anticholinergic drugs we will study. You will come to know little much more in detail we will study. But here we just try to understand in competitive antagonism the effect of the acetylcholine are prevented by giving atropine, because atropine will be in more concentration, and with more concentration it will inhibit the action of the acetylcholine at the muscarinic receptors. The third one is non-competitive antagonism. Here non-competitive antagonism, again here at the neuromuscular junction there are some receptors at the neuromuscular junction. So this is the presynaptic neuron, this is the postsynaptic neuron and neuromuscular junction, and this is This is presynaptic neuron. This presynaptic neuron is having vesicles, and in that vesicles acetylcholine is there, and this acetylcholine come out of the vesicles and at the receptors, postganglionic neurons, it act on that and it shows the effect on the NMJ, neuromuscular junction. So here decamethonium will block all the receptors at the neuromuscular junction and will block the action of the acetylcholine. So this is the non-competitive antagonism. The next is physiological antagonism. So this physiological antagonism, this is the example where a person suffers from anaphylactic shock. So during anaphylactic shock, the drug which is given, it has to show on different type of receptors, physiological antagonism. So physiological antagonism, here the drug is given adrenaline. This is the example for physiological antagonism. So what happens in physiological antagonism? You must understand the term anaphylactic shock. What is anaphylactic shock? You just try to understand. For example, I am explaining this. For example, a person goes to a doctor for some ailment and he prescribes the medicine, that is, he prescribes the penicillin injection, that you have to take this injection from the dispensary, penicillin injection. And the physician or the doctor, without knowing that person may be sensitive to penicillin injection, without knowing that, without having sensitivity test, that person may be sensitive to penicillin, he injects the penicillin without knowing that. And what happens? When penicillin goes inside the human body, it acts as an antigen. बाहर से कुछ भी जब बॉडी के अंदर जाएगा, it acts as a antigen. तो at that time, this antigen will create its antibodies. It will form its antibodies. So this antigen antibody reaction may take place. One dose is not going to affect anything, but suppose already antibodies are there and antigen antibody reaction will take place and it will cause clamping, it will cause coagulation, or it may cause some shock like situation which will cause burst of mast cells. So what is there in the mast cell? In mast cell in human body, it is having histamine, and all these mast cells will burst. The moment these mast cells will burst, this histamine will come into the bloodstream, and this histamine will cause fall in the blood pressure. Fall in blood pressure as well as bronchospasm. So these two actions, what will happen? Once again I will repeat. Suppose a person goes to a doctor and he prescribes penicillin injection, and the moment penicillin injection is injected to the patient, it acts as an antigen and antibody reaction can take place in his body. That जैसे पंजाबी में बोलते हैं वो reaction कर रहे हैं. So reaction कर गया तो means it will cause burst of the mast cells. Mast cells is there inside the body, and burst of the mast cell will happen, and mast cells are having stored in them histamine. All the histamine will come into the blood stream, और histamine जैसे ही blood stream के अंदर आएगी, histamine का ये action है, it will cause fall in the blood pressure and bronchospasm. सांस लेने में दिक्कत आ जाएगी, bronchospasm और fall in the blood pressure. जितना नॉर्मल ब्लड प्रेशर है उससे काफ़ी डाउन आ जाएगा, एंड इमीडिएटली पर्सन विल फॉल डाउन. बंदा जो जिसको इंजेक्शन लगा, he will fall down, and this shock like situation is called as anaphylactic shock. तो उस टाइम पे फिजियोलॉजिकल एंटागोनिज्म हमने काम करना है. We will give immediately adrenaline injection. Adrenaline injection will act on some different receptors and immediately उसका blood pressure shoot कर जाएगा and we can save the life of the patient. So this is the example, that is adrenaline in treatment of the this anaphylactic shock. Adrenaline given in the treatment of anaphylactic shock. So this is the best example. Adrenaline is given in the treatment of the anaphylactic shock. This is the best example for the physiological antagonism. So I once again repeat, I finished by this topic antagonism. I have completed this in 2 lectures. First, what is antagonism? Antagonism means when the 2 drugs, they act on the same physiological system but show opposite effects. So different type of antagonism: chemical antagonism, competitive, non-competitive, and physiological. Thank you.